Hi everybody, it's David Porter. Today I want to talk about substance abuse treatment. In a prior video I talked about evaluation. Proper treatment is predicated upon correct diagnosis. In order to diagnose, you must evaluate thoroughly and correctly, and you must take multiple and redundant measures. Redundancy and multiple measures tend to increase reliability. So now it's time for treatment. It has been established, the patient's been thoroughly evaluated through clinical interview, clinical observation, paper and pencil testing, and urine tests, and self-report. We have concluded this person is dependent upon a chemical substance or chemical substances, and they fit the criteria, the three main parts of the criteria, which are they have high tolerance for the substance, they experience a withdrawal syndrome when use of the substance is discontinued abruptly, and they continue to compulsively use the substance despite multiple severe consequences which directly result from the use of the substance. So those are the three main criteria. Now what? Treatment. Here's how I do things. I seldom refer people to rehab. 28 days is grossly inadequate, and that's about all that an insurance company will pay for, not what's clinically indicated, and a lot of insurance companies won't even cover the full 28 days. It's going to be 7 or 14 days. I tend to steer people away from rehab unless they specifically want to go, already have it set up prior to our first appointment. Bug interrupting me. I instead steer people away from rehab and refer people to IOP, which is an intensive outpatient program. It is typically a 3x3 model. 3 days a week, 3 hours a day. 3 hours a day, 3 days a week for 3 weeks. It involves a great deal of saturation. It is done in a group therapy format, and at the conclusion of the 3 weeks, there's going to be a titration of clinical contact, meaning it's going to go to 2 groups, 2 1-hour groups per week for several weeks, could be 3 weeks, could be 6 weeks, and then aftercare, or aka relapse prevention group, which is 1 hour a week, and a person can stay in that indefinitely as long as they need it, more or less, depending on the program. Again, not all programs are exactly like this. This is typical. This is an overview. In addition to the IOP, while attending IOP, highly recommended someone new to recovery is doing 90 and 90. That is 90 Alcoholics Anonymous meetings every day for 90 days. And I realize not everyone is using alcohol. Some people are primarily using or exclusively using drugs. Go to AA anyways. Why? AA is the model. It is a great program. I only have positive things to say about AA. It is a great program. It is the most effective means of gaining and maintaining sobriety and staying in abstinence long term and having optimal quality of life. I haven't seen anything else work in 23 years. Not except for AA. Yeah, rehab will work for a month. Outpatient counseling that I provide, that can work. Meds and can work. But if someone wants to keep away from drugs and alcohol, not just quit, but stay quit, AA, in addition to these other methods and measures I'm trying to spit out. Let me have a sip of coffee. Hang on. That's better. I can feel my synapses working again. Okay. So IOP and AA, concurrent. See an individual outpatient counselor, concurrent. Or you don't want to overprogram or overload people. Maybe at the conclusion of 3 weeks when things slow down a little bit. Get through IOP and then start seeing an individual counselor. A good IOP is also going to involve a consult with a psychiatrist. It might be necessary to prescribe meds to manage cravings or to manage anxiety and depression, which can certainly precipitate and be a contributing factor to substance abuse, and may very well be an emergent factor once someone becomes clean and sober. They're going to look around at their life and the mess they have made of it through a series of extremely bad life choices born out of their compulsion to use drugs and alcohol, and their life is going to be a mess. They will have hit the proverbial bottom hard, and now it's time to clean it up. That's going to be a lot of work. It's going to be pretty daunting. It's a primary reason for relapse, and if you can get somebody, an SSRI, to help manage their mood and get them emotionally stable, and that helps them to stay sober, do it. Go for it. If you can get a physician to prescribe meds to manage cravings, there are a number of options. Suboxone for opiates, and also Suboxone for opiates. Naltrexone for opiates. Naltrexone also has applications for alcohol cravings. Acamprosate, which is also called Camprol. Topamax, also called Topramate, for managing cravings from alcohol. There are a number of options available. There's some good scientific evidence that micronutrient supplements can help with the recovery process and help manage anxiety and depression, specifically omega-3 fatty acids, vitamin D3, vitamin B complex, microminerals, zinc and magnesium. The person is going to have to change associations. They're going to have to disconnect from every single person they ever bought drugs from, sold drugs to, used drugs with, drank alcohol with. They're going to have to completely disconnect from them, and that means you can never speak to them again. And that's hard, because it could be your family, could be your friends you've known your whole life. If you want to be clean and sober, they've all got to go. And that's hard, man. That's hard. That's hardcore. That is harsh. But I have not seen it work if people stay connected to the people that they are using with or have used with, or again, bought from, sold to. You got to disconnect and change associations. You have to engage in lifestyle changes. You can't live the same life you lived when you were using if you want to be in recovery. What does that mean? It means you have to eat nutritious food. You have to hydrate properly. You have to get up early, go to bed early, get sound sleep. You have to get sunlight exposure every day, at least 30 minutes. You have to pick up heavy shit and set it down, repeat as needed. You need to work out, you need to train. Writing in a journal, highly recommended. Don't let all the bad stuff ricochet around in your head, causing spallation and damage in your head. Get it out, put it on pen and paper, or a Word document, get it out of your head. If you are an artist or a painter, get it out that way through your artwork. If you're a musician, get it out through your music. But you cannot hold this stuff in your head. It poisons you. You got to find a way to release it. Chemical dependence recovery can really be summed up in 2 words: hard work. But recovery can work. Recovery does work. I have seen people make 180-degree changes in their life and become psychologically healthy and physically healthy. And it doesn't mean their life is perfect. It means they are now capable, they are optimized. They are now capable of handling what comes their way in life and dealing with things with a strong mind and a strong body, a strong will. I have also seen a lot of people crash and burn. I have seen a lot of people hit bottom. They found a pick and shovel there and dug in deeper. I've seen people hit bottom and bounce. I have seen people die from overdose, from suicide, from homicide, from degenerative disease, which claim their lives prematurely in an untimely manner. So not everyone is going to make it, and that is something you have to be willing to accept if you're going to be a drug and alcohol counselor. You're going to help some people, some ways, sometimes. Not everyone is going to make it. That's a grim reality. And everybody, if you want to be a clinician, you walk into a clinic, you are probably going to be fed all kinds of bullshit, and your expectations are going to be set very high. And you're going to be probably young, fresh out of graduate school, and full of energy and optimism and enthusiasm. You need to do some expectation management to have longevity in the field. Again, you're going to help some people, some ways, sometimes. You're going to watch a lot of people fail. You're going to watch people die. And it's part of the ride. I don't want to discourage anyone from going into this profession, but rather go into it with your eyes open, know what you're getting yourself in for. Okay. Now, speaking of picking up heavy shit and setting it down, that's what it's time for me to do. By the way, yeah, I'm just talking about weightlifting. It's so good for you. Alright, so I'm going to finish the last sip of my coffee and go get my dose of iron. Everyone, thank you for watching. Please hit subscribe and be safe.